Imagine the panic of a highly contagious disease lurking in your neighborhood, forcing over 150 young kids to stay home from school for 3 whole weeks. That's the shocking situation gripping South Carolina right now, and it's a wake-up call about the power of vaccination. But here's where it gets controversial. In an age of debate over personal choices versus public health, this outbreak raises tough questions about why some families opt out of vaccines, potentially endangering entire communities. Let's dive into the details and unpack what's happening, step by step. So even if you're new to this topic, you can follow along easily. Health authorities in South Carolina are sounding the alarm that the extremely infectious measles virus might be circulating unnoticed in communities across the northern part of the state, particularly in Spartanburg and Greenville counties. Just last week, officials in Greenville pinpointed an 8th confirmed case of measles, which could very well be connected to the ongoing outbreak. Since September 25th, 7 cases have already been identified in the nearby county of Spartanburg, with the spread traced back to 2 local schools, Fair Forest Elementary and Global Academy, which is a public charter school. At these 2 institutions alone, at least 153 children who hadn't received the measles vaccine were directly exposed to the virus. As a precaution, these kids have been placed in a mandatory 21-day quarantine, meaning they're not allowed to go to school or participate in group activities during this time. This quarantine period matches the longest possible incubation time for measles. That's the span from when someone first comes into contact with the virus to when symptoms, like a rash, might start showing up if they've been infected. You can see state officials explaining this in a recent press conference video available online. The connection between this latest case in Greenville and the cluster in Spartanburg isn't fully clear yet, leaving experts puzzled about how the virus jumped between these areas. This latest case highlights that measles is actively spreading in unrecognized ways within our upstate region, making it crucial for everyone to get their measles shots, stated the South Carolina Department of Public Health in their official announcement. And this is the part most people miss. Measles isn't just a childhood illness from the past. It's a real threat today, especially when vaccination rates drop. To protect against measles, the medical community recommends 2 doses of the measles, mumps, and rubella MMR vaccine, which boast an impressive 97% effectiveness in preventing infection. And that immunity lasts a lifetime. Without this shield, though, measles is incredibly contagious. It can infect up to 90% of unvaccinated individuals who come into contact with an infected person. The virus spreads effortlessly through the air, like tiny droplets from a cough or sneeze, and it can hang around in a room's airspace for up to 2 hours even after the sick person has left. For beginners, think of it this way. Measles is like a stealthy invader that exploits gaps in our defenses, but vaccines act as a strong barrier to keep it out. Of course, this leads to heated discussions. On one hand, vaccines are hailed as a triumph of science, saving countless lives by eradicating diseases like smallpox worldwide. On the other, some argue that personal freedoms should allow parents to choose, citing concerns over side effects or philosophical beliefs. And this is where controversy sparks. Is it fair to quarantine unvaccinated kids to protect the herd, or does that infringe on individual rights? What do you think? Should vaccination be mandatory for all schoolchildren, or is there room for exemptions? Share your thoughts in the comments below. I'd love to hear agreements, disagreements, or even personal stories. After all, outbreaks like this remind us that public health is a shared responsibility, and open dialogue is key to finding solutions.